Welcome everyone to this webinar that's going to focus on conceptualizing and contextualizing livability for Bangkok. This is part of a webinar series that is designed to support the livability indicators that have been developed through the partnership project with RMIT University, the Bangkok Metropolitan Administration, Vic Health, the Victorian Department of Health and Human Services, and the UN Global Compact Cities Program. My name's Hannah Badland. I'm one of the chief investigators in the project, and today I'll be talking to you about livability in the Bangkok context. I'd like to start with acknowledging the people of the Woiwurrung and Boiwurrung language groups in the Eastern Kulin Nation in Australia, of whose unceded lands we conduct our research, training and service. We respectfully acknowledge ancestors and elders, past, present, emerging, who have always been caring for country. We pay our respects to country and the life world that sustains us all. And if we are committed to a shared future with Indigenous peoples everywhere. So I'd just like to start with framing health along a spectrum. What you can see from this figure is that health spans from society through to individual health. When we typically think of health, we think of hospitals, doctors, nurses, and services that typically treat people who have already presented with disease. However, we're also looking for a broader model of health which supports healthy living, prevention and health promotion. And often these interventions are delivered at a society level where people either do not have the disease or are not at risk of the disease. And if we are intervening at that level, it's not really the health sector that supports this. It's more around government policies, governance, urban planning, education, what we call the upstream determinants of health, also commonly known as the social determinants of health. But what is important in terms of intervening at the society level, it means that it's a range of actors who are engaged in ensuring good health, from government, private sector, public sector and non-government organisations. So when we think about the social determinants of health, these have been defined as the conditions in which people are born, grow, live, work and age, and the circumstances shaped by the distribution of money, power and resources at global, national and local levels. So they're things that are influenced by the BMA, for example, in terms of policies that might be developed. They're also shaped by the national politics and also the global infrastructure we work in. Some examples of the social determinants of health include family circumstances, the land, the built environment, access to health care, housing, employment opportunities, and education right through from early childhood through to university. And all of these work together to create opportunities for people to lead a healthy and socially inclusive life. So why would we use neighbourhoods and cities to improve health, particularly through the social determinants of health lens? So firstly, we can have a population-wide impact. That means that we can actually change the behaviours of people who may not even have presented with a disease or condition yet. So they might not have cancer, they may not be obese, or they may not be smoking. So that's effective within itself. Neighbourhoods and cities can be fairly easy to change when you compare in comparison to changing an economic structure or actually individual behaviours, which can be very challenging to actually roll out on a large scale. It's a preventative approach, so people often haven't even got the disease yet, so they're still hopefully working and contributing to society. And it's an empowering approach where people can actually make decisions for themselves while not feeling that they're being told what to do. And lastly, there's many co-benefits to operating at a neighbourhood and city level, such as reduced greenhouse gas emissions. It might be through having people walk more or take public transport, so they're less likely to rely on a private car, for example. But we do need to be careful when we are intervening at a city level. The World Health Organization and the UN have produced a document in 2010, so it's a little bit old, but it is highlighting that there are inequities within cities. So we know that particularly when people shift from living in an rural environment and move into cities, they do tend to suffer poorer health, and these can come back to the social and living conditions. So informal settlements, they may not have education, they may not have resources such as family to support them. But what we do need to do is actually understand these inequities within cities a bit more deeply. So we need to actually get good data that don't operate at a city level, but they're actually able to drill down into district and precinct level and neighbourhood level to actually understand who's doing well and who's not, and what levels of disadvantage people are facing. And the next point around the solutions lie often beyond the health sector, comes back to the social determinants of health, where it's actually the wider policy framework that sits above people that actually shapes health rather than necessarily being prescribed medication or having access to a doctor. And lastly, and this is largely where a lot of the sustainable development goals are being framed, is that its leaders and governments actually have a key role in promoting urban health equity. And that's often through partnerships and engaging with a variety of different sectors to develop policies and practices that support the social determinants of health. So what we can see in terms of urban population projections is that overall the world population is growing. But what's interesting is when we look at the different regions, Europe, North America are staying largely flat. Latin America and the Caribbean are showing slight increases, but the greatest population growth is happening in Asia, followed by Africa. And when you look at Asia, which is the orange figure, the orange bar graph, you can see that we're actually seeing a shape in the cities too, with more people, with cities becoming larger with more populations in them. Another way we can look at this is to look at the population projections for Thailand in particular. So the graph on the left shows a red and a red and a green line. The red line is urban population and the green is rural population. And as of 2018, what we saw was a reverse, with the rural population sharply declining and the urban population sharply increasing. So that tells us that people are migrating from rural environments to urban environments, and quite rapidly. So that poses a challenge for our city planners in terms of how do we create our cities to be health promoting, socially cohesive and functioning. When we look at, on the right hand side, when we look at urban population by city size, what you can see is that what we're seeing is larger mid-sized cities. So cities between 500,000 to 5 million people. We're seeing an increase of those from 1990 to 2018 and then up to 2030. So they're new cities being created, or people are coming to these mid-sized cities and increasing the sprouting up everywhere. So this framework, the Sustainable Development Goals, was developed by the UN in 2015. And it replaces the Millennial Development Goals, but they're designed to be a call for action for all countries, poor, rich countries, and middle income. And it's got the focus of promoting prosperity while protecting the land and ending poverty. So it's focused on economic growth, but while addressing a range of social needs, also what we call the social determinants of health. There's 17 goals spanning education, health, social protection, job opportunities, but it's also couched within tackling climate change and environmental protection. So many countries have adopted these in terms of best practice and planning. They're designed to exist until, or the framework's designed to exist until 2030. And it's something that is a really important mechanism to target the social determinants of health. So most importantly, underneath the goals, there's a series of targets with measures, and that allows countries to be held accountable for achieving the SDG targets. So when we look at Thailand, you can see this came out in 2018. It's the benchmark of how Thailand's going towards achieving the Sustainable Development Goals. When you look across the Asian region, it scores slightly higher than the regional average, so 69 versus the average score of 64, and it's ranked 59th out of 156 of the participating countries. That's an interesting dashboard that you can see on the right hand side. So you'll see that Thailand's doing a really good job of achieving SDG 1, 6, 11 and 13, but doing not so well on SDG 2, 9 and 14, for example. So it's a great way of reporting how countries are going, and to also identify potential interventions and levers to help lift overall performance. So the Sustainable Development Goals is tied closely to what we call livability. And over the last probably 6 to 7 years, our group at RMIT and the Centre for Urban Research, the Healthy Livable Cities group, we've been working to really understand what livability means and how to operationalise it. We conducted quite a significant international review back in 2014 to look at how livability has been defined, conceptualised, and what types of indicators have been used in assessing performance of livability or measuring it. What we found was there was no definition. So our work, some of our foundational work, looked to actually provide a definition that we set primarily for the Australian context, but it's largely transferable across high-income countries. Very closely linked to the social determinants of health, but being safe, attractive, socially cohesive and inclusive and environmentally sustainable, with affordable and diverse housing linked via convenient public transport, walking and cycling, infrastructure to employment, education, public open space, local shops, health and community services, and leisure and cultural opportunities. So when you distill that down, it really falls into 7 livability domains or attributes, being employment, food, housing, public open space, social infrastructure, transport, and walkability. So essentially, they're some of the key, what we call ingredients, that are important to have within a neighbourhood or locally available to support good health and well-being. The next stage of our research program was to actually understand how the livability domains related to a range of different health and well-being outcomes. So we created a series of spatial indicators for the 7 livability domains, and we linked these with health and wellbeing data sets and tested associations. So you can see that employment is associated with sitting time and self-rated health. Food, access to food is related to diet and body size. Affordable housing is linked with community satisfaction and self-rated health. Public open space is associated with walking. Social infrastructure such as education, health services, community services, that was related to self-rated health. Public transport was linked with walking, sitting time, body size, and self-rated health. And walkability was found to be associated with walking and body size. So these are really important physical aspects of the neighbourhood that do translate into health and well-being outcomes for people. So this work really laid the foundation for our ongoing collaboration with the BMA, and it led us to doing our first livability pilot project, where we worked with the UN Global Compact Cities Program and the BMA to really understand what livability meant from the Bangkok context. So we started with the workshop back in 2017, and then we supported that with a literature review of livability indicators that are used in a global context or specifically for low to middle income country contexts. From that, we identified the indicators and measures that have previously been used, and we worked with the BMA to help understand what was most important for Bangkok in terms of livability and what data sets and indicators were currently available that could be used in the BMA's practice. This was shaped by a review led by the BMA, and from that we started prioritising what was most important for the BMA in terms of livability. So this was a one-year project that commenced in 2017, and from that we were able to prepare a draft livability framework, of which we've since gone into a much larger scale project over the last 2 years. So the first question was to understand the definition of livability that we had prepared for the Australian context, and understand whether or not that was appropriate for the Bangkok context. In general, the Bangkok context, it was similar to the Australian livability context of what is livability, but there were key differences. So when we considered housing, informal housing was a concern for Bangkok, whereas, informal housing, was a concern for Bangkok, whereas access to affordable housing was probably the most major concern for Australia. When we look at social infrastructure, temples and cultural events were very important for the Bangkok community and citizens, whereas cultural things weren't quite as important for Australia. It was more around access to community services, community centres. Environmental management came through strongly for Bangkok, particularly around informal housing and risk of flooding. Water sanitation to a lesser degree came through as well, whereas that wasn't really raised as a concern in Australia. So when we look at the main findings of the pilot project for Bangkok, we found livability was very important in terms of a way forward in the low to middle income country context, and particularly as it relates to the SDGs. Very similar focus on the social determinants of health, with slight differences in terms of priorities, and culture and resilience came through much more strongly in Bangkok compared with Australia. Within Bangkok and Thailand more broadly, some of the livability domains lack local data that could be used. So that made us start to think about what other types of data sources could we use if we wanted to create indicators to start measuring the livability domains. And what we found is that there was quite an untapped opportunity to use open source and routine data sets to create indicators, and that's something where we've really worked hard in the last couple of years to actually create a suite of indicators, livability indicators that are relevant to the Bangkok context, but are often harvested from open source data sets. And some of the forthcoming webinars will explain which data have been used to create indicators and how the indicators have been created, and then ultimately how you can access them within the portal. So we've had a couple of research outputs that have come from the pilot work. I've included the links below, so they're freely available, so you can access these. The first one is a academic journal publication outlining really the pilot project. What is the meaning of urban livability for a city in a low to middle income country? And that's Contextualising Livability for Bangkok, Thailand. Please feel free to access that paper. And we've also prepared a report which is available on our website, and that has a little more detail in terms of what we did, how we did it, and a summary of the findings. Now, I just wanted to move on to some examples of case studies that you can access in your practice. So, we know that urban planning and features of the neighbourhood environment and the city environment are important for supporting good health and wellbeing outcomes. And the question is, what do we actually know is effective, and what are some good examples and best practice studies that we can consider if we're looking at trying to understand which interventions to use. So I've just included a couple of different resources that you might be interested in looking at. The first one is an Australian National Heart Foundation resource called Healthy Active by Design, and that's really advocating for healthy urban environments that support primarily physical activity as a way to reduce risk of cardiovascular disease. So the Healthy Active by Design toolkit provides resources and support to organisations who are interested in the development of healthy livable places and spaces. But what you can see is that you can actually search by functionality. So what type of project are you interested in? What design features are you interested in? State won't be as relevant for Bangkok's work, but you can look at whether or not it's urban, regional, rural, or remote. So you can tailor your search to understand the types of environments that closely match what you're interested in. The next one is another resource by the Government Architect of New South Wales. It's got a series of case studies which aren't probably as broad as those covered in the Healthy Active by Design, but it does have some best practice examples to draw on, and in particular around more community design, social cohesion. So slightly different focus, but again, freely available with the website down below. And there's also the US philanthropy, the Robert Wood Johnson Foundation. Now, they've been advocates for the built environment and health for over the last, probably beyond the last decade. And they have some really interesting case studies that span not only the physical infrastructure, such as public transport access or public open space access, but actually looking at policies and engagement and advocacy. So again, depending on what type of examples you're looking for and which types of groups that you're wanting to work with, there may also be some really useful resources and guiding materials in the Robert Wood Johnson Foundation site as well. So thank you for your time. I really appreciate it. I hope it's helped lay the foundations for livability in the Bangkok context. I'd like to thank our project partners, the Centre for Urban Research, BMA, Vic Health, who have funded this project through the Sustainable Development Goals Partnership Rounds, the UN Global Compact Cities Program, and the Victorian State Government Health and Human Services. My email's below if you do have any further questions. And I hope you enjoy using the portal and the indicators are useful for your purposes. Thank you for your time.